Hi everyone, I'm Dr. Craig Morgenthau, and this is my partner, Dr. Stephen Hodgett. About 25% of the population experiences gastroesophageal reflux disease, or GERD, and 7 to 10% have daily symptoms.
Now everyone experiences some reflux, but GERD is abnormal acid reflux that causes long-term symptoms and damage to the lining of the esophagus. Symptoms can include frequent heartburn, regurgitation, trouble swallowing and eating, upper abdominal pain, chest pain, also less common symptoms like asthma, bronchitis, recurrent pneumonia, laryngitis, chronic cough, hoarseness, and bloating. GERD can greatly impact your quality of life. In fact, if left untreated, many patients with GERD have lower quality of life than those with cardiac disorders like congestive heart failure and angina.
You might be wondering what causes GERD. Abnormal function of the esophagus, defective muscle at the lower esophagus, which may be due to a hiatal hernia, abnormal stomach function, or a family history of GERD or hiatal hernia. Treatments like changes to lifestyle and diet, as well as weight loss, may relieve your symptoms. Many people find temporary relief with reflux medication, but those can lead to other problems, and medication may not help in severe cases. If you're experiencing symptoms of GERD, it's not a good idea to wait it out, hoping it will heal on its own. Prolonged reflux can lead to damage of the esophagus with inflammation, ulcers, strictures, and Barrett's esophagus, which may, in rare cases, lead to cancer.
As the first reflux surgery center in Jacksonville, we have new minimally invasive options, which have helped many people, like our patient Hope.
I suffered from reflux for about 25 years, and I carried it through into my 40s. And I knew that that feeling every day was not normal. On a daily basis, I had heartburn, reflux, pain shooting from my stomach all the way up through my throat. And it wouldn't matter what I ate at this point when I got to my wit's end.
Hope had a procedure called magnetic sphincter augmentation with placement of the LINX device. LINX is a small ring about the size of a quarter made of flexible interlinked titanium beads with magnetic cores. It's implanted around the lower esophageal sphincter just above the stomach. The beads open when you swallow food or liquid and then close once food is swallowed so stomach acid can't back up.
There is another minimally invasive procedure we perform for GERD called fundoplication. This technique reinforces the lower esophageal sphincter by wrapping the top part of the stomach around the bottom portion of the esophagus. Both LINX and fundoplication are usually done robotic or laparoscopically, which involves small incisions in the abdomen. Both procedures take about an hour.
For patients who are morbidly obese, the best anti-reflux procedure is usually gastric bypass. This treats reflux and also provides weight loss and improvement of many medical issues associated with morbid obesity.
Your surgeon will help you determine if you're a candidate for surgery and which approach is best for you. After having either reflux procedure, many patients return home the same day. You'll need to take it easy for the next 2 to 3 days.
Quality of life now is amazing. I feel like I can do anything, far more than I could before the surgery. I can have my pool day, I can exercise, walk my dogs, not worry about being symptomatic. I finally feel like I got my life back.